Unfortunately, last night our OR Executive Committee had to make a decision. So you know who's made up of the OR Executive Committee. We have all the chiefs of our major surgical services, anesthesiology, neurosurgery, Department of Surgery, along with administrative members from the various departments as well, and our chief of staff. And a decision was made that we have to cancel all elective surgeries here at the Ouellette campus until we know the actual cause of the problems we're facing, which I'll discuss in a few minutes. Again, that decision is made to err on the side of patient safety, what we're facing. At the same time, the way we get trauma patients here at the Ouellette campus is through a provincial system called Criticall. We've notified Criticall of this situation, and we are not accepting any patients through Criticall. They'll be either redirected to London, Toronto, or Detroit, if the case may be. We're continuing to work with our equipment manufacturers, again, to find out the source of the problem. Also on site is an international expert that deals with sterilization issues. They are testing our water, they're testing our steam, they're testing the water, the whole system from start to finish. So water coming in to our system, water going from our powerhouse into our sterilization system, and then leaving the system as well. Following through, testing the steam, testing the water to determine if there's any issues with respect to that as well. And I'm going to show you part of the sterilization process and what the issue we're dealing with right now, where we're getting these cloths examined by a third party to determine what the issue is on them or what the problem is. And of course, we're going to try to maximize our surgical capacity as best as we can at our Met campus. The problem is there are certain surgical procedures, say for instance neurosurgery, which we cannot physically do at Met. We do not have the physical structure and or the equipment that's affixed in the rooms in order to do cases like that, specialty services like that at the Met campus. So those surgeries, again, on a trauma basis or emergent basis, would be happening outside of our facility. At the same time, we are working with a third-party entity that does sterilization off-site and would bring the instruments in. We tried that, and unfortunately the instruments that we had sterilized by them also continued to have this similar problem. So we're examining again why. So what happens is there's a chance whatever chemicals or combination of issues are still with our instruments that we have, and we're going to have to address that situation once we find the source of the problem. So just to give you a little idea of what we're facing is Cole's notes on the whole sterilization process. What happens is after when the instruments are dirty after a surgical procedure, they're brought into our medical reprocessing area, and they're cleaned off first of all, but then they're put through a wash, the instruments. And what they are is washed of all the sediments from the previous surgery, and then decontaminated with the special chemicals that decontaminate the instruments, right? So they can be reused. So that process takes place. They're dried, and then they're put on trays. On the tray is a blue cloth, and then there is this white cloth as well on the tray as well. They are wrapped and put into the autoclave, or the area where it's steamed, and there's a steaming process that takes place which completes the whole sterilization. I think the steam is 132 degrees, 134 degrees for about 30 minutes, and then they're taken out and they're cooled down, and then that whole thing is wrapped. There's stickers on them which identify if there's any moisture in there. These stickers identify, because moisture in this process is one of the main causes of not having a sterilized set. That happens from time to time, and that alerts that there's a problem. There's a sticker on there that shows that there's moisture. Also, when they're then brought to the OR and opened up, the package is opened up. There's of course visual inspections that are done with respect to the instruments and the packaging to determine if they're totally dry or if there's any issues. What we discovered most recently is this issue which we call scorching staining, and it's on the white cloths, and you can see it here. It's these brown lines, so when they undo it, the staff notice these lines. This is what we're getting tested, and this is what we're getting trying to find out what the source of this, what's causing this particular respect to what it is. We are not facing similar issues at our Met campus, although the equipment is different, and of course the whole, the system itself is different at our Met campus.